Hi, I'm Dr. Alicia Billington, and today we are going to talk about what type of imaging and when you need to get it if you have had silicone breast implants. So back in 2006, the recommendations were that you get an MRI 3 years after you have your implants placed and then every 2 years thereafter. In 2019, the FDA updated these guidelines, and they are now saying that the first imaging you need is about 5 to 6 years after the silicone implants are placed, and then about every 2 to 3 years thereafter. The recommendations have also changed to state that you can now get an ultrasound instead of getting an MRI. The MRI can be reserved if there are equivocal results from an ultrasound or if there are symptomatic reasons that you would need to get that MRI. This is really important because in the PRS journal recently, which is the Journal for Plastic and Reconstructive Surgery, they published an article looking at how many people are actually following these guidelines, and only about 6% of patients are actually getting appropriate imaging. Being up to date and knowing which imaging modalities you need is very important, especially because insurance often will not cover an MRI or an ultrasound, and an ultrasound is a lot cheaper. So if you have silicone breast implants, make sure that you are following the guidelines and you are getting imaging every 5 to 6 years after the implants are placed, and then every 2 to 3 years thereafter.